Thank you, Madam Speaker. The Prime Minister, aided and abetted by the NDP, have spent 9 years implementing their radical vision of Canada. And he would like everyone to believe that this agenda is normal. Record food bank usage, out-of-control gas prices, and a housing market that has priced young Canadians out of the dream of home ownership. Censoring the internet by controlling what people can see or say online. A 39% increase in violent crime. Catch and release bail that sees offenders arrested in the morning, out by noon, and then rearrested later that very same day. Legalizing meth, cocaine, heroin, and opioids in British Columbia. Parents worried that their children could step on used needles in a playground. None of this is normal. These are the outcomes of radical policies brought to us by this NDP Liberal Prime Minister. His legacy is one of crime, chaos, drugs, and disorder. The results of his hard drug legalization experiment and taxpayer-funded narcotics policy have been tragic but entirely predictable. Since 2015, over 42,000 Canadians have died from drug overdose. Opioid overdose deaths have increased 186% across Canada under this Prime Minister's watch. A record 2,500 British Columbians died from drug overdose last year. That's up 380% in 9 years. That's 6 entirely preventable deaths every day. Friends and colleagues, mothers and fathers, sons and daughters. Each of them had a story, and every one of these deaths is a tragedy. These are human beings. Drug overdose is now the #1 cause of death in BC, with more fatalities than crime, accidents, and disease combined. It's also the #1 cause of death among kids, ages 10 to 17. I have 11-year-old twin grandsons. This is personal, and this is not normal. The story of 14-year-old Camilla Sword of Port Coquitlam is heartbreaking. Camilla tragically overdosed in her bedroom in August 2022. According to her father, the coroner found 3 drugs in her system: MDMA, cocaine, and hydromorphone. Hydromorphone is an opiate prescribed under BC's so-called Safe Supply program. Camilla's friends reported that they've witnessed children as young as 11 years of age using hydromorphone. This is completely unacceptable. The street price of hydromorphone has fallen up to 90%, from $20 to $2 per pill. Basically, any kid can buy them. How many more children have to die before this government reverses course? Our common sense Conservative motion before the House today calls on the Prime Minister to end this unsafe supply program and redirect this money into treatment and recovery programs for those addicted to drugs. This is common sense. This is compassion. The radical approach of this NDP Liberal government is making the addiction crisis worse and does not put those struggling with addiction on a path to recovery. That should always be the goal. Their approach only pumps more hard drugs onto our streets, killing our citizens, destroying our families, and tearing apart our communities. The oversupply of these free drugs gets into the hands of organized crime, who then sell them to children. If you get them for free, any return is a profit. Addiction workers confirm that most users of so-called safe supply are diverting these drugs and reselling them across the country. This is government-funded drug trafficking. How's this for sanity? In Prince George, the police ran a 10-day surveillance operation on a woman who stood outside a downtown IDA pharmacy every morning, trading her so-called safe supply drugs for harder drugs. Police reported dozens of hand-to-hand transactions. The pharmacy manager told the RCMP that patients are given up to 28 hydromorphone pills per day, equating to approximately $480 a day if resold. He also reported that many patients are accosted by people outside the pharmacy wanting to purchase the safe supply drugs. And the insanity is the brainchild of Big Pharma. The term safe supply is their sales jargon, their propaganda, meant to secure government contracts and pad their burgeoning pockets. Let's be clear, safe supply is a lie. There is nothing safe about fentanyl. This radical NDP Liberal government bought the big lie, and now Canadians are paying the price in dollars and in deaths. Canadians have the right to know how much they are paying to fuel this crisis. This government refuses to release their contracts with Big Pharma, covering up the huge cost of this reckless experiment. This radical government doesn't get it. Their policies are killing Canadians, and they clearly don't care. Despite the death, crime, and carnage, the Prime Minister has not ruled out replicating BC's failed drug experiment in other jurisdictions across the country. Our motion calls on the Prime Minister to proactively reject the City of Toronto's request to legalize deadly hard drugs like crack, cocaine, heroin, and meth. This motion further calls on him to deny any future requests from provinces, territories, and municipalities seeking federal approval to legalize hard drugs in their jurisdictions. We do not need to export the drug chaos in BC to other jurisdictions. The Prime Minister should never have granted a reckless exemption to BC to allow open, in-your-face, hard drug use in public places. Parks, beaches, transit, sports fields, coffee shops, and playgrounds in BC have become drug-infested nightmares. A 2-year-old girl was hospitalized after putting a discarded needle in her mouth at a park. Even our hospitals, once a beacon of safety, are now lawless places where healthcare workers and patients are put at risk. The BC Nurses Union is sounding the alarm for its members. Patients and staff have been exposed to harmful and hard drugs. Meth was even being smoked in a unit just hours after the birth of a newborn baby. This breaks my heart. It should break everyone's hearts. A nurse in Campbell River said she'd been exposed to hard drug smoke 6 times. How in God's name is this government allowing this to happen? I can't believe I have to say this, but hospitals should be sanctuaries of healing and care, not lawlessness and chaos. After 9 years, this extremist NDP Liberal government is not worth the drugs, disorder, and death. Only a common-sense Conservative government will end unsupervised and unprescribed use of hard drugs in hospitals. We'll end taxpayer-funded narcotics that are killing our children and poisoning our communities. We'll focus on treating Canadians struggling with addiction, providing a path to recovery so we can bring our loved ones home drug-free. Hope must be restored. Unlike this radical NDP Liberal government, we're not giving up on them. Compassion, common sense, the deadly drug experiment, this extreme experiment, must end and never be repeated. Thank you, Madam Speaker.